But ladies and gentlemen, the topic that we have selected for today and are going to be enlightening ourselves, of course, along with you, is something so unique. And I feel like, Shahzad, in more than 3 years, I haven't spoken about it. I mean, it's the first time we came across it in a way. So we have heard about it. You hear it sometimes as a joke. You hear it sometimes as a proper news. You do your research. But to actually be in conversation with someone who's practicing it is the first time.
Exactly. Yes. And before we kind of give it away, I think I have a very funny incident to share with everybody who's out there, and that is because, you know, every time, God forbid, if somebody was ill at my place, you know, they might have flu, they might have temperature, or they might be involved in any other illness, God forbid. So my mother would always be like, hey, you know what, I've never ever taken a medicine. And she does not even take medicine. No matter what happens, how ill she is, she's like, okay, I know how to kind of recover. I know the kind of food I need to eat. And no matter how much you're going to push her, you know, even if you're going to put a pill in her mouth, she's going to spit it out as well. And, you know, so I always used to think that, Mom, you know, the Niaz going where, and you know what you're doing, imagine the practice, and do you think that all of these people who get so much of education and then kind of try to tell you that this is how you're going to get better. And 5 of your daughters are doctors. Yeah, alhamdulillah. And this is how you're going to get better as well. So Mom's like, okay, you know what, you guys think what you guys want to think, and I will do what I have actually learned from my mother or from my parents as well, and I'm going to continue the practice. And I've seen her, alhamdulillah, she looks the youngest amongst all of us siblings as well. Alhamdulillah, she's fit. She wakes me up early morning every day. She goes for a walk. And to my surprise, alhamdulillah, what I've seen is that I've never actually seen her, you know, very ill. You know, I mean, she will get temperature, she's going to get better in 2 or 3 days and 4 days, and that's pretty much about it. But then there was this a contradiction in between science and then what's actually happening with my mom's biology of the body as well. And then I was like, okay, you know, maybe probably this is something which can happen, because she will always have these home totkas as well, that, okay, you know, this is what I'm going to do, and she would always get better. So I thought that, okay, it might have been the power of belief in the first place that she kind of recovers without even taking medicine.
Well, this is really interesting, and I think we are going to explore that today.
Yeah.
And, well, just to relate, I want to say that maybe I have a soul of someone, you know, your mom's age as well. For real though. Because I keep saying it to everyone at my place as well, I do not believe in medicines. I think I have to mention there are days when I do have to end up, you know, taking one of those because, you know, worst comes to worst, you have to do it. Unfortunately, but I feel like I do have this belief the medicines are not going to do anything for me. And most of the times, if I do end up taking it, it doesn't do anything for me. So I really want to learn how it works. So, go on.
So ladies and gentlemen, today we are actually going to be in conversation with a doctor who's actually kind of supporting and is the brand ambassador for not having medicines at all, and then kind of getting closer to nature, because nature has actually kind of provided us with every solution out there as well. And all we need to do is that we need to kind of look after our diet. We need to kindly go see her in the first place as well, and then kind of whatever she tells us, because she does not believe in medicines at all. She once had a practice where she actually kind of prescribed medicine to a lot of patients out there, but then she wasn't satisfied because people at times weren't getting better, and she thought that she kind of had played a role in them being sick, which is why, you know, she wrapped it up. She went for a PhD. She did a PhD online as well, and then after that, it's been 17 years that she's been running that clinic, and alhamdulillah, every other person who's actually going to her clinic is a happy soul and a healthy soul, and that too without medicine. How is that happening is something which we'll be talking about. And ladies and gentlemen, we're very lucky that we've actually been joined by Dr. Shagufta Feroz, who happens to be a consultant physician. Hello ma'am, assalamu alaikum, good morning, how are you?
I'm good. Thank you very much for giving me these moments of sitting here and enjoying the way you have greeted the viewers, because you already have manifested one pillar of lifestyle medicine, which is happiness and positive psychology.
Exactly.
So you were cracking jokes, and you were talking about laughter and smile. So it's good. So I'm glad that you have already talked about lifestyle.
Wow.
I like to hear that.
That's wonderful, and which is why, you know, we want to kind of know about, and our viewers would, because we go out in 46 different countries, alhamdulillah ma'am, and we want people to kind of know what lifestyle medicine is all about. And when we say that we're not going to use any medicine, is that true?
Yes. Lifestyle medicine actually fixes the root cause of a disease. And this was realized about 15-16 years before by John Kelly, an American, who was given an award of excellence by American Associations of Physicians, because he thought, and then later he formed a forum called Blue Ribbon Panel, and all the experts of different medical specialities were part of that panel, and then they formulated this speciality, which is actually a speciality of medical sciences.
Right.
And it fixes the root cause, and it is based on the principles of epigenetics or on the principles of environmental medicine and behavioral sciences, right? It fixes 6 things in a person's life. Number 1, nutrition. Number 2, sleep. Number 3, exercise. Number 4, stress management or happiness. Lifestyle medicine doesn't want to emphasize on the term stress or depression, because they think that depression is already a pandemic globally.
Exactly.
So they have taught us to talk about happiness instead of talking about depression.
Yeah, and that's good.
So and the fifth factor is that it talks about social connections, that the way we are connected with each other is good for our health.
Wonderful.
Then the 6th one is addictions. So the withdrawal of smoking, alcohol, drugs, and in Pakistan I talk about food addictions also.
Yeah.
Oh, so important.
Which is why first thing which I'm actually going to ask you before I kind of forget about it as well, because ladies and gentlemen, every time we are about to go on air, we sit down with our guests and we kind of talk about, you know, how life is and what things are about as well. And you know, there was this viral clip over in the internet as well, where there was this one person who said that no matter which household you're going to go to in Pakistan, the first thing they're going to ask you is, "Cha pini hai? Cha pee lo, cha pee lo, aa rahe ho to cha pee lo, ja rahe ho to cha pee lo." And you know, he kind of looked frustrated about it as well, that you know, that it shouldn't be the only drink which you should be offered.
Yes.
So almost 32 billion rupees worth of chai or tea has been consumed by Pakistanis last year.
Insane.
So if you have to say anything about that habit or food addiction, please go ahead.
Okay, if they have consumed tea, I would have been very happy.
Okay.
Because tea leaves have got antioxidants which are beneficial for health.
Alright.
But when you turn tea into doodh patti, it is toxic.
Okay.
It turns toxic.
How?
So you're talking about green tea. Green tea is
No,
good?
doodh patti is more of milk and lesser
yes,
of...
I am talking about doodh patti.
Yeah.
A tea which has about more than 4 tablespoons of tea is a doodh patti.
Okay.
So the tea which has got black or dark chocolatey color is tea.
Yeah.
Then it will work positively on your body. If you are added milk, then it has got many problems. And the symptoms are atypical. Atypical symptoms. You can't put the symptoms under one heading. Right?
That's
so
true.
this is a very common, by the way, addiction which you talked.
Exactly. And
And
not
it's so
just this,
funny
you know,
go on.
towards the end of the night, I have this habit of having like 2 or 3 cookies as well. I mean, every night I have them.
Shazad, I feel guilty because just last night, so I discovered this new place in Islamabad, and they make super delicious macarons, okay? And I'm not crazy about sugar, and I would literally just buy an entire cake to take one bite. That suffices me. In one sitting, I finished 6 macarons, okay? Wow. And now I feel like this is such a bad thing I did to myself. On this note, ladies and gentlemen, we actually have a very comprehensive report for you guys to check out about lifestyle changes that you can make. When you come back, we still have a lot of questions to throw her way.
We need to talk about all those 6 pillars one by one.
Okay.
Let's do it.
Chronic diseases including heart disease, stroke, diabetes and cancer account for some of the most common health problems. Yet many of these chronic diseases are preventable as they're linked to poor diet and lifestyle choices including tobacco use, excessive alcohol consumption and inadequate physical activity. By making positive diet and lifestyle changes, it can help reduce risk. Eating healthy foods, getting enough exercise and refraining from tobacco and excessive alcohol use confer numerous health benefits including possibly preventing the onset of chronic diseases. Moreover, regular daily physical activity can lower your risk of heart disease. Physical activity helps you control your weight and reduce your chances of developing other conditions that may put a strain on your heart, such as high blood pressure, high cholesterol, and diabetes. Some people cope with stress in unhealthy ways such as overeating, drinking or smoking. Finding alternative ways to manage stress such as physical activity, relaxation exercises or meditation can help improve your health.
So I believe that Dr. Shagufta and we are actually on the same page, because exactly what she said, we had it in the report as well. But now, ma'am, you know, since even the report kind of talked about a healthy lifestyle changes as well, we will get into that. But let's discuss all the 6 pillars. So the first one is nature?
Nutrition.
All right. So
it is the major pillar.
So let's get started with that. So how do you think nutrition will actually help us? God forbid if we were ill, imagine that there's blood pressure, there's stroke over here in Pakistan, there's hypertension, diabetes, these are the most common diseases. God forbid if somebody has got them, how do you think that their nutrition will actually help them get rid of it?
Why do you think that it is only going to help you when somebody falls sick? Yeah. It has got a preventive role. Okay. So we have to learn about a dietary discipline.
All right.
What type, what time, what combinations. This is the way to cook the food, the correct water intake. So food is about this. Exactly. So the American version of nutrition is that they are promoting whole food, plant-based diet. Okay. Predominantly. So in Pakistan, I talk about predominantly plant-based, but I, being a Muslim also, I don't think that we can completely eliminate meat from our
but being nutrition. A doctor, do you think we should? Because it doesn't make sense to me.
What?
Excluding meat.
Yeah. So they ultimately they will say that we need meat. So whenever science goes to one extreme, it is ultimately proven wrong. Okay. So I believe in rule of moderation. So I always encourage my patients to have meat in small quantity, and the other portion of the food should be lentils, pulses, vegetables, grains. Wheat is excellent food for Pakistanis, and food varies from region to region, from culture to culture, and from race to race, and even for age groups, the combination of food varies. Okay. Right? Then comes sleep. We are not aware that most of the Pakistanis, they are not able to sleep, go into deep sleep, I would say. If a person is sleeping but the mind is working, you are not sleeping. True. Your body is not being rejuvenated at night. So I talk about nocturnal sleep or night sleep. Then comes exercise. Exercise, there is a prescription for exercise. Lifestyle medicine talks about writing a prescription for exercise. Exercise will not help you if you just go into the gym and start doing the exercise without knowing your body, without understanding the need your body is in for exercise. So exercise, and there should be a prescription for it. Then stress or happiness. I don't talk stress. I always ask my patients, what are your favorite things to do? And I found that everybody wants to laugh. Yeah. So I ask them just to have a laughter session with your children, or watch some comedy program on the TV. It is the easiest tip to diffuse stress. Yeah. And to make a person happy. Initially they look at me and they think that as if I am not a serious doctor. And once they incorporate laughter into their life, then they say that we have started feeling good. I can tell you that in the beginning of the program, I started feeling relaxed when you were talking about little humorous things. So I felt better. Yeah. So then comes addictions, and I mostly talk about food addiction. If you work on food addictions, you can help a patient or a person in withdrawal of their other addictions. Like I have worked on alcoholics without telling them that they are working on the withdrawal of alcohol, just by organizing their food. Wow. Right?
Oh, wow.
Then comes social connections. Social connection, the component is based on a 75 years Harvard study, which is called Grant study. Over a period of 75 years, they followed students of a Boston college, and they found the people who have gone through experienced longevity, they were the ones who were good in their relationships. Right. So the social connections were added to lifestyle medicine, and I call it Hukukul Abad.
Wow.
Of course, yes.
So if you are good with your spouse, with your children, amongst the siblings, your neighbors, you will be a good person, and you will be adding life to your quality of life to your life.
And majority of the things which you actually kind of spoke about are the things which any individual, if they kind of practice, they're just happy at heart as well. That, hey, you know what, maine dene kisi ki nahi hai, lene kisi se nahi hai, I'm good to everybody out there. Right. And you feel relaxed at heart as well, and it kind of gives you that breathing space which you actually wanted by having this content within your own self as well, that, hey, you know what, Lamia, I think that you're razi with me, and this is how I want to move forward in life. Shukr, alhamdulillah.
Yeah, and I think that's beautiful, and so, well, it's easier said than done too, but we'll get to that. Because when you're talking about a lifestyle change, Shazad, it doesn't happen overnight, right?
Yeah,
you really have to adopt and strictly adopt to newer things.
I was about to ask something in relation to that.
Okay, so you can do that. I just wanted to say, you mentioned that this is preventive, but is it also curative?
Yes, it is preventive, it manages a disease and it reverses a disease. And I am talking about chronic diseases because this was introduced for chronic diseases. WHO realized that by 2020, 2/3 of the diseases are going to be dependent on lifestyle. So it does reversal, and my patients know that I work on the reversal of diabetes, autoimmune disorders like rheumatoid, eczema, psoriasis. So these are the things which we are never able to fix, because I have experienced all this for the first 15 years of my practice.
Exactly.
So would you say even the genetic ones that are like undeniably they are going to occur at one point, are they reversible?
Yes.
Oh, wow.
Lifestyle medicine is based on epigenetics. And epigenetics talks about environmental factors. And environmental factors includes all the 6 pillars.
Right.
So if you modify those factors, you can modify the genes. Genes are like a bunch of wires which need to be activated by unhealthy food, by sleep deprivation, by accumulating a lot of stress. If you avoid these factors, you put those genes in a sleep mode.
Exactly.
Wow.
And thank
and
you
I
very
thought
much.
genes were just to be treated like we could only change them physically.
No, I don't think that we can actually change them physically.
We
but
can.
No, I don't think so. Because they're innate, they're inborn, and so how can we do that physically? I think they just have their own course. God forbid, if you're not going to sleep, some genes will activate. For example, just because I have a little bit of information on this as well. So, for example, if you talk about leukemia.
Okay.
Now, in chronic myeloid leukemia, what happens is that there's this one gene which kind of picks itself up and goes and overlaps onto another one, which kind of produces white blood cells in a larger amount as well, and it is life risk disease as well. So what happens is it is because of the fact that that there might have been some adverse changes within your lifestyle that, God forbid, it actually picked it up from there and placed itself onto somewhere else as well. But the doctors still do not know what the cause is, and that cause might probably be because of the fact that they do not know the lifestyle of the patient. But now, ma'am, talking about it, what I want to kind of, because they say it's BCR ABL something, which picks it up, 9 or 22, they overlap, and then that's when leukemia happens. But ma'am, now when we go to a hospital, God forbid, what happens is that for hypertension, we're going to go to somebody else. For stroke, we're going to go to see a neuro. For my arm pain, I'll probably go to an orthopedic. But the kind of practice you're doing with every disease, and everybody will just come to you.
Yeah,
I mean,
one
may it be
answer.
from hair to eczema, because you just mentioned about it. May it be skin, may it be eyes, may it be heart, may it be hand. So I mean, it's a one-window solution for anybody and everybody who's going to come in. But what I want to kind of ask now is that, okay, you said that, okay, it's preventative and it's curative as well. Now, for all of these diseases which have been there, do you think that there's this power of belief which needs to be in there as well? Or if anybody is going to kind of follow whatever these 6 pillars will entail for them, and whatever you're going to prescribe them in their lifestyle changes, will actually reverse the disease and kind of hit them on the grassroots where the problem was?
Okay, it's both ways. Sometimes patient need to come to me with a belief, and sometimes patient is in a state that he or she is not supposed to believe what I am going to do. The patient is brought to me by their children, because the patient yesterday, like I can share with you. Yesterday I was just looking at a cancer patient with metastasis all over the body, and believe me, she was on foods which were 100% supporting cancer. Right? So she was not having any choice. So I just modified her food, and after experiencing, they developed the faith after they experienced the change. And the well-being is the number 1 symptom which comes after 2 weeks, because the feeling of well-being comes from your immune system. And unfortunately, as a doctor, we are never able to fix the immune system. And you have seen this in current pandemic of COVID. US is the master of all sciences. What has happened in US? So we are not able to handle immune system. So once the immunity starts fixing, there is a feeling of well-being, and they say, and they come, they say, I don't know why, but I'm feeling better.
I feel good, yeah. And this happens to everybody out there as well. There are 2-3 days when you've slept enough, you're eating the right amount of food, you're offering your prayers. in 1 or 2 days time, I feel like as if today I'm going to go to the gym and lift all the weights up as well. You know, this is the feeling you get. But now, ma'am, very quickly towards the end, obviously we want you to kind of speak about what prevention would you kind of prescribe to all of those people who are out there. Maybe, God forbid, let's talk about the most common diseases, which may be hypertension, stress, and your stress management. But on number 2, what I kind of want to ask you is that for anybody and everybody who's actually coming to you, obviously they're bringing their patients, because this is something which I've been through myself as well, that I was going to a Sufi Sahib for a dam as well, but I was continuing my medicine too. You know, so I was a passenger of both the ships or the boats as well. So what do you want them to do? Do you want them to kind of leave all the medicines all of a sudden, God forbid if they come to you with any other disease? Or would you be like, hey, you know what, you lower it down gradually and then we'll kind of come down to what I'm prescribing you?
Let me clarify. I never ask my patients to stop their medicine. I never interfere in the prescription of their physician. I never interfere, which is very unethical. My treatment starts parallel to their treatment, and their physician is supposed to watch their progress. They keep doing their test, and if there is a change in their test, they themselves, because most of the physicians are not aware of lifestyle medicine. So I don't want to create a conflict for my patient. So once they see the changes, they start withdrawing the medicines. And withdrawal of medicine, depending on the ailment, it takes 6 months to 2 years time. If somebody is having autoimmune disorder, it might take 2 years time. Right? So it varies. So none of the patients or none of the viewers should know, should get this concept that I am against medicine, because I am a very loyal medical doctor. So I am not.
But I think right now you're actually giving a very hard time to Pakistani pharmaceutical industry.
And this is going to be my last question, because please give us a few quick tips for, you know, all the most common diseases these days. There's a viral going on, everybody's coughing.
Dengue.
Let's talk about that. Dengue is there, and then, you know, blood pressure is there as well. So let's talk about, give us solutions for that. And last but not the least, you know, for all of these benefits pharmaceutical companies has to offer to all of their doctors who prescribe their medicines. I mean, it's been 17 years, alhamdulillah, that you haven't got any of that benefit.
I am no more an attractive doctor for them.
Do you miss those benefits at times?
No. I never miss those benefits.
Wonderful. We're on a lighter note. But please tell us a few quick tips for virals these days.
Okay. I am going to give you general tips. Number 1, please have a tummy full breakfast. And breakfast is not toast or rus or oats or kulche. Breakfast should be roti. The composition of the breakfast should be anaj and proteins. So have either whole wheat bread or roti with eggs or kebabs or chane or dal. Right? Then drink water properly. If you keep drinking water right after the food, you are just making your stomach get weaker, because you are diluting the acid of the stomach. Number 3, drink tea properly. It should be brown tea with very less milk, and tea should always be before the meal. If it comes 5 to 10 minutes before your breakfast, it will work as a digestive aid. If it comes after the food, it will aggravate acidity.
I hope same with coffee.
Coffee is about 1 hour before the meal or 3 hours after the meals. Then about the desserts, a very important principle: don't have desserts after the food. By taking sweets or foods or drinks after the food, you lead to chronic diseases like cardiac disease, diabetes, arthritis, and obesity.
But you know what I've been trying to follow is the sunnah of Prophet Muhammad sallallahu alaihi wasallam, that to have a little bit of sweet right after the food.
I have confirmed this, by the way. I have confirmed this from a doctor who came from Medina University, and he told me that Aap sallallahu alaihi wasallam has said, if you want to take meetha in good quantity, it should be alone. And if you want to take meetha in a small quantity, it should be right after the food, which I fulfill by asking my patients to take green tea right after the food by adding shakkar.
Wow, that's wonderful.
That's nice.
Thank you very much, ma'am, for coming over here, for taking out time and kind of spreading awareness in 46 different countries as well. And, you know, it was an honor to have you, and that too for somebody to kind of practiced something else, in the first early years of her career and reached the peak where she's actually kind of consulting 80 to 100 patients every single day, then wrapping it all up because you didn't feel great at heart, and then learning and then doing your own PhDs over and over again, and then kind of giving us this amazing facility over here in Islamabad, in Pakistan as well. So ladies and gentlemen, the name is Dr. Shagufta Feroz. Please make sure that you kind of check out on the social media as well. The pages will be out there. And if there's any other information, we will actually put it out on our pages as well. But thank you very much, Dr. Saiba, for being with us. Lovely to be in conversation.